everyone. Today we will discuss about Marfan syndrome, which is a disease caused by mutations in genes that encodes structural proteins. What are main things that you should know about Marfan syndrome? That this is a genetic disease that affects body's connective tissue, and you know about what is the role of connective tissue in our body. Actually, they give strength, support, elasticity to tendons, cartilage, heart valves, even to blood vessels and other parts of body. Marfan syndrome, this is hereditary, which means that it can pass to a child from a parent who is affected, and it shows autosomal dominant type of inheritance. And I have already talked about all the types of inheritance in my previous video, and in this type of inheritance each child has one chance in two of having the disease, and this is only manifested in heterozygous state. This disease affects the bones, eyes, skin, lungs, and our cardiovascular systems. We can see this patient who is suffering from the Marfan syndrome, which has overgrowth of bones, and this is one of the many the symptoms of Marfan syndrome. Here I have shown you about the inheritance pattern of Marfan syndrome, and if for one father has the affected the gene, then 2 of 4 children will be affected by this syndrome. What are causes of Marfan syndrome? This is caused by defect in glycoprotein called fibrillin-1. These glycoprotein are secreted by fibroblast cells, and which are the cells that synthesizes the extracellular matrix. So this glycoprotein is major component of microfibrils that are found in extracellular matrix. Microfibrils, what is the role of microfibrils? The microfibrils actually act as a template for elastin deposition during elastic fiber formation, and therefore they are very essential for maintaining the integrity of tissues such as blood vessels, lungs, skin, and ocular ligaments. Therefore these type of the tissues are mainly affected by this syndrome. And the ectopia lentis is actually a displacement or malposition of crystalline lens of the eyes, and and this disease is mainly caused by the Marfan syndrome. In this disease the lens in this disease lens is displaced by his original position. Actually we know that lens is supported by placed by the zonule fibers, which are very fine fibers. Disruption or dysfunction of the zonule fibers of the lens causes ectopia lentis. Here we can see the displacement of lens. And what are genetic causes? Fibrillin, which is encoded by gene FBN1, which is located on chromosome 15. Actually this is an example of a dominant negative mutation which prevents assembly of normal microfibrils. This syndrome can be explained on basis of various structural failure of connective the tissues, but when we see there is an overgrowth of the bones, but that cannot be only because of loss of fibrillin. So we now believe that there is excessive activation of transforming growth factors known as TGF-beta, and these have the deleterious effects on our vascular smooth muscle development and integrity of extracellular matrix. What are the symptoms of Marfan syndrome? There are several symptoms of the Marfan syndrome, but the severe type of complications are seen in heart and lungs. If we talk about heart problems, they weaken the connective tissue of walls of aorta. The weakened walls may result in blood seeping between inner layers of the aorta wall, and which is called the aortic dissection. It also affects pumping ability of our heart. If we talk about lungs problems, air-filled sacs, which is called the cysts, may develop in the lungs. The cysts may rupture, bringing air into space that surrounds the lungs. These disorders can cause pain and shortness of the breath if a person is suffering from this disease. Eye problems, we have already discussed about eye problems, and now we will move on towards the musculoskeletal problems. And people with this Marfan syndrome, they are the taller, they have the overgrowth of bones, and their sternum is deformed and pushed outward or inward. Here we can see that sternum is pushed outward, and joints may be flexible, and this is the displacement of lens, and the roof of the mouth is often the high. What type of the complications may occur during the pregnancy? Marfan syndrome can weaken the walls of the aorta. We have discussed it. So the main artery that leaves the this is the aorta. During pregnancy, a woman's heart is actually pumping more blood than usual, and this can put extra stress on woman's aorta, which increases the risk of deadly dissection or rupture. And this is about the prevalence. Prevalence in the Marfan syndrome is estimated to be 1 in 5,000. About 70 to 80 percent of cases are familial, and the rest are because of new mutations that happen in one gene in germ cells of the parents. And this prevalence remains the same regardless of the sex and regardless of ethnicity. And if we talk about the treatment of this syndrome, and actually those drugs are the used whose aim is to decrease our blood pressure, to make blood flow more gently through the aorta. And usually beta blockers like propanol, they are the used to slow down our heartbeat. And angiotensin 2 receptor blockers, they also may be given to lower blood pressure. Angiotensin receptor blockers, which they inhibit the activity of TGF beta activation, the factors improving aorta and cardiac functions in most models of the Marfan syndrome has been seen. And so these are the treatments that we can do for Marfan syndrome recovery. And I hope you like this video and hope to see you next time.